Good afternoon, everyone. Welcome to another Facebook Live Lunch and Learn with the Center for African American Health. I want to first start by thanking you for joining us today. I also want to encourage those of you who haven't had a chance to do so already to participate in our Be Heard Mile High Health Priorities Survey. It is imperative for us to understand your health priorities so that we can better serve our community. We'll include a link to that survey in the chat below. We'll wait a few more minutes for people to tune in, and then we'll get started. And while we're waiting, I'll introduce myself and tell you a little bit about our work at the center. My name is Deidre Johnson, and I am the CEO and Executive Director for the center. For those of you who are unfamiliar with our work, we are located in Northeast Denver, and we have been serving our community for 23 years with a focus and commitment on improving the health and well-being of the African American community. We do this in a number of ways, including community-based, evidence-based, disease prevention and disease management programs and events. We are also a family resource center, working to help families thrive. You can learn more about our work and our programs by visiting our website at caahealth.org. So as we move through today's session, please feel free to type your questions in the chat box, and we'll address them if time permits. Today, our topic of discussion centers around the COVID-19 pandemic. And despite how some folks are acting, we are in a pandemic. The reality is that this is not going to be over anytime soon. Our challenge as a community is how we can effectively embrace this time of change and really approach it as an opportunity for growth. I'm very excited today because joining me is the perfect guest to discuss visionary thinking. Futurist Chet Sisk. Chet is a published author and founder of Universal Basic Resources. His company works in partnership with the Community Development Society to provide grants to communities who are creating climate-strong projects and help battle income inequality at the same time. He's also the producer of a television series called Change the Subject, a program dedicated to helping the general public understand what they can do to thrive and succeed in a time of massive change. In his most recent publication, entitled You and the New Normal, he conveys the need to create space for clarity during these unprecedented times in order to develop a vision for moving forward. Welcome, Chet. Thank you for joining us today.
It's my pleasure, Deidre, and I'm just so glad that you and I have finally got a chance to do this. We've been talking about different formats in which we could get together, and this is just fabulous. Thank you.
The universe conspired. So.
Yes, absolutely. Yeah.
You know, go ahead.
No, I was just going to say it's interesting that we are talking about the COVID pandemic. As I mentioned to you just in our pre-show, that I did get the COVID virus. I had it at the beginning of March. It went on for about a couple of weeks, and it seemed like it would never end. And this was when everybody was just now getting information about what it was. We didn't know. I thought it was a cold. My wife thought it was a flu, and then I sat back and we looked at each other and I said, I think I have what they're talking about on television. I think I have COVID. So it took a lot out of me, but it was something that I wouldn't wish upon my worst enemy. Only because of the fact that it went on for so long. And I knew where I got it from. It was from a conference I did just the week before, about 400 different people. And I was engaging. And I was there, glad handing, meeting with people, 400 people in a closed room. So eventually, something had to happen. But I'm alive and I'm well, so I'm happy.
Very glad that you're on the other side of that.
Yeah, me too. But I'm sorry, go ahead. I was thinking about it.
It's all important. So the weight of the world is certainly heavy right now. In addition to the general fear of the unknown precipitated by the pandemic, people are navigating grief, job loss, racial inequities, and an overall sense of anxiety about the future. Can you speak to this new normal we're currently living in?
Yeah, that's the title of the book. I was just about to get into that. The title of the book, the You and the New Normal, that talks about this new kind of world that's emerging. Now, I know that there's a lot of grief and frustration and angst and anxiety going on, but I also want to frame this thing differently, at least I do in the book, that this is also a moment for us to push the reset button on things we didn't like that led up to this. Now, remember, there's some things that led up to this world where, especially things like systemic racism and a healthcare system that doesn't work, income inequality that's forcing people into these really dire situations because of COVID. There were things that didn't just come out of the blue. There were things that led up to this. So in a sense, COVID kind of puts us at a place of being able to ask the question, who do we want to be when we grow up? And that's the moment that we're in now. So I say there is an opportunity for us to leverage this moment into something special, but we have to be able to see it first. And that's why you have people like me. My job is to help us to visualize what's possible on the other side. Without that, it just becomes, what happens is that we start to get into this feedback loop of talking about how dour and terrible things are. And we never really get to the other possibilities of what this opportunity presents. So I don't mean to make light of the stress and the anxiety and the angst that people are going through. I'm just saying that there's another part of this that we have to look at as well.
It seems like we're constantly talking about, especially media and what we're seeing, bad things, which in turn can break the human spirit.
Yes.
How can people, especially our folks of color, adapt a visionary mindset when historically we've been marginalized for so long?
Well, there are a couple of things that we need to remember. Visionary thinking is not necessarily our collective strong suit. We have a lot of people who are visionaries individuals, but collectively, we have to use some historical context here. You have 250 years of telling you the only thing that is valuable is survival. Anything outside of survival is not valuable unless you die and go to heaven. That was your only recourse outside of the immediate. So the idea of thinking visionary, of thinking long term, was not cultivated collectively inside of our experience, and not just in slavery, but also during Jim Crow, also during segregation. I mean, really, we're still in the survival mindset. So
Sure.
that collective survival mindset doesn't lend itself to thinking when we start talking about vision. So the first time that to me was ever even challenged was when we saw the movie, the Wakanda movie, The Black Panther, because it had a vision of us in a way that we haven't collectively put together. Now, those of us who've read, Kindred and some other Afrofuturist books, we have some kind of idea of us outside of this context, but collectively, the Black Panther gave us some kind of a vision of that. And so really what's important is for us to recognize that we tend to lean toward only right now. And so we tend to look negatively upon the future. And so every time we talk about futures, and I want to talk a little bit about the whole aspect of vision parties, we have to talk about it in an affirmative, positive way with other people to support that vision forward. Otherwise, what happens is that we absolutely only get the information that's pounded into our heads day in and day out by the media, by the politicians, and then that becomes our truth. It becomes a self-fulfilling prophecy. And what I'm suggesting is that we have to rethink how we are thinking, recognizing that we are in still survival mode, but now we have to get to thriving mode and leverage this moment. And I don't want to make it an intellectual exercise. It's not that. It just means that we have to have an affirmative vision forward, not blind optimism, I don't believe in that. And I met people who kind of get into that blind optimism. Oh, everything's going to be great. Okay, well, what are we doing to make those things great? And there are some things that we can absolutely do to fortify that affirmative, positive vision forward so that we actually are able to do something other than sit around and wait for the next CNN news broadcast.
Right. It reminds me of that old example of the frog in the boiling water as it
Mm,
starts to boil. It
yeah.
doesn't notice the temperature rise because that's
Yes.
never known.
Yeah, and so in a sense, again, that's really my job, is to help us to get to the place of recognizing that there are some things happening that we haven't. It's an invisible hand, as it were. I call it the invisible hand. But there are things that are affecting our thinking that we may not realize is affecting our thinking, and then it's cumulative. So you hear it over an extended period of time, it becomes a truth for us. And I want to offer another truth, and that other truth is agency. And agency isn't something that has to be given to us by someone else. It's something we claim for ourselves. I want to remind us also, particularly African Americans, to recognize that yes, we are having a 400-year experience, but for thousands of years, we lived in agency where we had an idea, a vision of who we were, how we walked through the earth. So, yes, this is happening now, but it doesn't diminish the fact that the power of agency rests inside of each and every one of us. So, we don't have to wait for someone to define things or to change things in order for us to develop a way forward. We don't have to wait for that. It's easy for us to go there because we've been inundated into this for so long. We think it's a truth. It is a version of the truth, but there's another version too, and that version comes from here inside of us.
So in your book, you suggest that the current paradigm shift, the COVID-19 pandemic, can be viewed as an opportunity instead of a
Yeah.
crisis, which you just mentioned,
Yes.
if we change our mindset. And
Mm.
so, it's one thing to say change your mindset or the mental model you have.
Yeah.
But, even changing diet or exercise habits is a
Yeah.
haul. So when you think about changing your mindset to imagine what's possible, how do you start doing that?
Yeah, I tend to think of these things in aggregate, that you cannot have an affirmative mindset about a positive way forward, but yet still practicing like really crazy diet practices. I mean, they all work together. Do you mind if I share like just 8 things that I know that work together for that positive mindset?
No, please do.
Okay, I will. Well, first of all, I'm going to run through them real quickly, and then we can come back and talk about any one of them after that. But the most important thing is that we absolutely have to get out of the Western diet. It is madness. It is causing hypertension, heart disease, obesity, all of those things. That's the high fat, high sugar, fast food diet that we've all gotten used to. And we've gotten used to it because there's advertising that keeps supporting it. So when you have compromised health, it's hard to think positively or affirmatively because you're constantly dealing with compromised health. I believe in a plant-based diet, and I think that will change a bunch of things even overnight. So it supports an affirmative mindset. I also believe that I truly do believe in vision parties. I mentioned this a little earlier, the whole aspect of us being able to get together with other people and finally starting to have conversations about what would another kind of direction look like. And it's important to be affirmed by other people and to have conversations with other people about that positive, affirmative way forward. I also believe we have to rethink the whole aspect of wealth. We have been inundated into this idea that all of us have to be Kanye West. Well, maybe not that example. All of us have to be Oprah in order for us to be happy. And that's just not true. I don't know about you, but I know a lot of millionaires that have this issue, this challenge, where they have all the money in the world, but they're incredibly unhappy and uncomfortable. So we have to rethink what wealth is. Is that just our connection to other people, our connection to family? How do we develop that wealth? Our health is a part of that wealth as well. We have to reconnect with friends and family. We have to recreate and redirect our attention so that it's not siloed. The technology today can lead us into being siloed, where we're isolated from other people. But we can also use this technology to have these kinds of get-togethers, like you and I getting together now. It's been a minute since this last time I saw you, but here we have this technology that allows us to do this. So the technology is a toaster. You can use it to silo, or you can use it to connect. I connect with my siblings every week. Um, they're all over the country, and we get together and just talk. And I would say our relationship is closer now than when we were kids, simply because we use the technology to reconfirm our relationships. We also can start to read some really great authors. Me and my wife have been reading like nobody's business. Everybody from Anand Giridharadas, we're reading Ta-Nehisi Coates. We're going through all of it, and it gives us this chance to have these really wonderful dialogues with each other. So, and they give us a bigger perspective. Also, I believe in expanding our belief base, that if we only believe that our salvation will come when we die and go to heaven, we've already mailed in this life. We're mailing it in right now, and I think that's what's causing the problems for the people behind us. Is that once we get to the place where we're just mailing it in, we're not even fully present because we're trying to get to heaven, then we do everybody an injustice. I believe in the phrase "as above, so below." So that means we start to expand our belief system to be present. And one other thing too, I feel very strongly about is that you have to put together a 2-year plan. We're in a place now where we have to start to think about what's going to happen over the next 2 years, because the next 2 years will decide everything.
It's interesting because in a way, so often we talk about not just health, but the social determinants of health. And
Yep.
each of those 8 things you mentioned are really just social determinants for that holistic approach.
Absolutely. I am particularly, uh, uh, I have a lot of energy behind the whole aspect of our diet. I think collectively we have a terrible diet because of the fact that we've been pushed into the Western diet for so long that we think that it's food. It's not food, it's food product. Um, I am happy to see that there are a lot of vegan soul food restaurants and menus and campaigns that are now taking place. I'm not vegan, I'm more vegetarian. I'm a conscious eater. And then, so as they used to say, we need to eat to live as opposed to live to eat. And this is an opportunity. And if we just started with that, just with diet, it would change so much, because it changes our personal health. It changes how we deal with other people. It changes our mood. It changes how we see ourselves in the world. If you're battling with a lot of health issues, trust, it's really, really tough to deal with the whole aspect of an affirmative mindset. And even more so, because we're now going to be dealing with COVID for at least the next couple of years, it's really important for us to drill down on wellness, meditation, and the different kind of diet and yoga and all of those things. That's our best defense against the COVID virus. So if anybody should be doing wellness and changing our diet, it should be us.
It's interesting because, and then before I move on to the next question, last December, I was going to do an experiment, but I've actually been a vegetarian since then. And it was so much easier than I ever imagined.
Yes, yes.
The exception over the 4th of July was I could call myself a pescatarian, but that was the first time I had anything. And I didn't miss it, and it made me more conscious because I couldn't just eat. I had to really plan, okay, what's happening today. And I still, cook all the favorites for my kid.
Yeah.
But it was so easy.
Yeah. No, you tell the perfect story. Is that the reality is that once you get into it, you don't miss the other stuff. And let's just say that you go to the cookout. We get invited to the cookout, and somebody says, "Yo, man, I got some ribs." Okay, so now let's say you indulged. It doesn't mean that you're going to go to hell and somebody's going to beat you with a stick because you just, you just had some ribs. It only means that now your body can recover from that longer, as opposed to if you're constantly putting these kinds of things in the body and the body doesn't do anything with it except store it as fat because it doesn't know what to do. So it's not a horrible thing to do something else if you want to. But my experience is like yours. Once you get into it and you start realizing that you consciously think about your food, you don't miss anything. You just, all you think about is how good what you're doing now is. And my wife is vegan, and she's introduced me to things I never thought was even possible. So a lot of stuff is really based around our pushback, if you will, against getting out of the Western diet that's killing us, is that it's based around myth. Oh, I'll miss it. No, you won't. Trust me on this one. You really won't. Not as much as you think you will.
So one question we had was, any suggestions on how to outline your 2-year plan? You know, when I was younger, I used to do a 3 to 5 year one, but I also needed to cheat because I was getting ready to go to college, getting ready to go to school, and then became kind of vague. But when you think about all these different areas that we're facing now, how do I get started on a 2-year plan?
That's a great question. I would say this, that people tend to think about 2-year plan as far as goals, but goals are really steps inside of the vision. So the most important thing is first to visualize, what is this next phase of my life going to look like? You have to think about what that's going to look like. And then you break up how to get there. In other words, you really build backwards. And you can do that month by month by naming monthly goals. So the goals, again, are steps to getting to the vision, but the vision is first. So when people say, I want to have $1 million in 2 years, well, that's not quite an effective 2-year plan, because it really has to be about who you want to be in 2 years. And what steps do I want to be? So the $1 million, who you want to be may not take $1 million in order for you to get there. Who you want to be may just take a change of diet, a reconnecting with old friends, all kinds of things that you haven't talked about. But those particular things can be monthly goals, steps, as it were, on the way to the vision that is 2 years away. So I would highly recommend that, breaking it up into months. And if you can't do the months, break it down into weeks. But you have to have these actionable items along the way that you can check off the list that helps you feel like you are on your way to your vision. Keep it simple, really.
Thank you.
And one other thing too, do it with a friend. Do it with a friend or a family member or some compatriot that will keep you as a partner, an accountability partner along the way. That's really crucial.
So your new book, You and the New Normal, is available on Amazon.
Yes.
And everyone can learn more about the universal basic resources by visiting your website, Chet Sisk, CHETSISK.com.
That's correct.
So last night, when I was getting ready for today, I purchased 10 copies of your book.
All right.
And we're going to be giving those away to the first 10 people. And the process will be this. If you're interested, please email Eric at caahealth.org. And in the subject line, put free book. And the first 10 folks to do that, the center will email you a book.
How cool.
We have to come back and do this again. I've got a couple other questions, but we're not going to get through all of it. But I want you to promise me that you'll come back.
I promise. I will. You know, I would do anything for you, Deidre. You know that. So yeah, you just name the time and the date, and I'm on my place. And I would love to see if we could do some kind of ongoing vision quest for the listeners. I think that would be really cool. A vision quest, so that we can all walk to our vision together.
You know, one last question. When you think about everything going on in the world, in addition to COVID and personal losses, we're having societal losses. And we just recently lost one of the big 6 leaders of the civil rights movement, John Lewis.
Yes.
People often look to leaders during times of adversity for hope and direction.
Yeah.
What advice can you give us on how we reach from within to carry on? How can we respectively work each in our own area of influence to
Yeah.
dismantle racism and remain persistent in our intention.
Yes. Well, I'll say something. This may sound a little difficult, but I'll say this, that I believe in a process and a philosophical concept called Ubuntu, which means that we are all connected. That's the shorthand version of it. All of us are connected. So when I think about the greats, I actually met C.T. Vivian, and he's just a wonderful human being. And these great people along the way that have come into our lives, they really still are pointing to the fact that it is us, not them. And if we're holding out for another Joseph Lowry or anyone, someone to come along and kind of fill in the gap somewhere along the way, I think that that's a mistake. I think we have to look inside, and we have to look at us collectively. We have to start to think, and people don't like to talk about that because they say, oh, it's too hard to to organize people. But it's not a matter of organize people, it's a knowing. It is a knowing that all of us have value and worth. And then once that knowing is there, you'll start to create the kinds of vehicles necessary in order for us to become these great human beings that we can become. This is our time to become our greatest selves. So the time of the giants, that's a great time, and we should honor that. But now it's the time for the giants, that is the collective us. And we have that moment, and this is that time. So I encourage you to go inside and then reach out with that and recognize that Ubuntu is true, that we are all connected and we are all valuable.
And especially if you think back to what we talked about earlier about historically having agency. If we think about thinking of life through a thriving frame versus a surviving frame,
Yep.
It's all interwoven.
Yes, and it's tough because sometimes we can get really caught up into the idea of the fight. What we want to do is that we want to just, fight about ourselves. And now our entire identity is based around whether or not someone makes a decision or they don't make a decision. That's not agency. Agency says we're going to do something no matter what they decide. This is our direction. This is our purpose. And we're going to create that. And again, that's part of the thriving part. That gets past survival into thrival. And I think that it is that time has come for us.
Let's see. Oh, so it looks like we are out of time.
Oh.
Matt, thank you so much. This has been wonderful.
It is my pleasure.
This video will be available along with other information on the center's website, caahealth.org. Please tune into our next Facebook Live, and next week, another exciting conversation. We will be speaking with Carlotta Lanier of the Little Rock Nine.
Oh, wow.
Yeah.
Oh, wow. That is fantastic. I bet she has some perspective that's probably right on point. That'd be great.
We're looking forward to it. Thanks again. And again, send an email if you want a book. I also got mine. So when I see you next, I'll have you sign it from a social distance.
I promise I will do my best. Believe me, I know firsthand. So I'll do my best. But I also have the antibodies, at least for now. Who knows how long they last. So.
Well, thank you again for joining us. And to everybody watching, thank you for joining us. And we will see you next week. Stay safe and be well. And imagine what it would be like to thrive.